I have the great pleasure right now of being joined by Dr. George Wendel, who is the incoming Executive Director of ABOG, and we're talking about maintenance of certification, certainly something you know a lot about, being a director currently, and a new pilot program. Tell us about it.
Sure, we're very excited about a new pilot program that we've proposed to the American Board of Medical Specialties for approval as a permanent change in our MOC program in 2018. And to summarize it, it's allowing physicians who are participating in our lifelong learning part of MOC, who achieve at a high level, to be exempt from taking the MOC exam at the end of their 6-year cycle. The MOC exam has been a test that we've got a lot of feedback that it's a lot more rigorous and takes a lot more time to prepare for, and if there was a way we could reduce that or eliminate it, people would be happy. So we can't eliminate the examination, but we were able to establish a pilot program that proposes that if you get 86% of your questions right in our lifelong learning program in your MOC cycle, you're exempt from the examination. So we did a careful look at the data from the last 2 years of the MOC exam and found out that people who achieve above this threshold don't fail the MOC exam. So we said, why should they go through that extra burden? If they've already demonstrated their knowledge in a rigorous fashion for 5 years, they don't need that extra assessment at the end of the cycle.
Because certainly the information is so important for everyone to stay up to date, but if they're doing that all along, you feel satisfied that that's still happening.
Yeah, that's exactly right. Our MOC program focuses on current and up-to-date knowledge. For example, this year we sent out articles about Zika virus in pregnancy management within days of the CDC releasing them, and told people if you read it, you could get extra MOC credit because it was timely and important for public health. And we think that kind of assessment of reading those articles is much more important to providing timely good care than an exam every 6 years looking at your core content of knowledge, some of which you may not actually use every day.
For people whose curiosity must have been piqued by learning about the pilot program and thinking, okay, I don't have to go through this 6-year assessment, how do they get signed up? Is it automatic? Should they be contacting you in some way?
Sure, as you might guess, it's more complex than it sounds. And when you sign up on our personal web page, it will tell you whether you're eligible for the program or not. There are very few ineligibility criteria. One would be a restricted license, like having your license on probation, or restrictions on your privileges that are very significant that would make you ineligible. But most people are going to be told they're eligible. And they'll also be able to look at the percent correct that they have on that other activity, the lifelong learning. There'll be a box that'll have a hover over it, and it'll tell you that you're either above the threshold or below it, and then you can calculate how you have to perform the rest of that year to get above the threshold. And as long as you're above the threshold, then you're in the pilot. And you can choose to take the exam and pay an extra fee, or you can choose to not take the exam and then don't have to study for the exam, don't have to take time off, don't have to go to the testing center, and all of that. And we think that'll be a real enhancement for our very busy, very dedicated fellows and diplomates.
Right, I mean, clearly you don't want to add to the stress of these physicians who in many cases are getting burned out anyway from beginning to end, but you want to make sure that, especially when it comes to things like Zika, they have all of the latest information. And I think in that way you can speak to the importance of MOC.
Yeah, the MOC, I think ours has not received the criticism that other boards have. In fact, we get a lot of compliments about our MOC program, particularly the lifelong learning, because it helps you keep up with what's important. Your colleagues that are the experts in OB, office practice, and gynecology are picking articles that you need to be a better doc. And then all you have to do is read them and answer 4 questions. And it's not so much an assessment of learning, it's an assessment for learning. So we have you answer 4 questions and you have to get 86% for the year. But the learning comes not so much from answering the questions, the learning's from reading the articles and then figuring out how to apply that to your practice so you can take better care of the women and families you serve.
It's a critical tool, and now you've made it easier. Thank you so much, Dr. Wendel.
Thank you.